Greetings, everyone, and welcome. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. Each episode, we bring leaders together to not only inform you, but also unearth bright spots, successes at health plans, hospitals, and other healthcare organizations across the world. Our goal is to identify as many of these bright spots as possible so that you can determine if the ideas shared during this very episode can be applied at your organization. We believe that this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. If you have not yet subscribed to Bright Spots in Healthcare, if you're new to the show, I encourage you to look us up wherever you consume podcasts. Type in Bright Spots in Healthcare, click subscribe, and you'll have downloaded on a weekly basis leaders from all across the industry who share strategies, tactics, and everywhere in between on what's working at their organization in their market. It's a great way to stay informed and to generate ideas to help you make your job easier. Our topic today is how plans can evolve from segmentation to personalization in population health. It's a super exciting topic, super interesting topic. Our sponsor for today's episode is League. If you haven't heard of League, they are innovating the consumer experience and imagining the state of our infrastructure as far as what we deliver digitally to our members. Imagine a next generation AI-powered healthcare experience that enables frictionless engagement for members. I think about, is it possible to take all the touchpoint solutions that you provide your members, put it into one app, working seamlessly and enabling your organization to offer true integrated whole person care in a personalized manner for each of the individuals you cover and support? League is doing this for carriers across North America. You could check them out at league.com. Super excited to have them as our partner for today's episode. They're the perfect thought leader to add to the portfolio of bright spots we're going to provide you all today. We have an incredible group, an incredible panel that Jessica Tenzer, our producer, put together for you. I'm going to introduce them by name, title, and company. If you want to see their full bios, if you are watching live, we're going to put those in the chat. And if you are listening, we'll put a link to those bios into the show notes. We have Karen Hanlon, the Executive Vice President and Chief Operating Officer and Steelers fan at Highmark Health. She also has a soft spot for the Bills. Welcome, Karen. Thank you for being here. We also have, representing the West Coast out in Seattle, we have Laurent Rotival. He is the Executive Vice President and Chief Information Officer at Cambia Health Solutions. Welcome, Laurent. And representing the nation of Canada, Michael Serbinis, the founder and CEO of League. Mike, good to see you again, and welcome back to the show.
Thanks, sir.
We're going to divide today's conversation into 3 segments. So those of you listening, this is how things are going to flow. We're going to start high level and really talk chess, talk strategy around consumer centricity. Then we're going to get into some of the execution and converting to personalization. And then we'll talk about the why it's worth investing in a strategy and getting into the personalization and some of the foundational kind of reasons organizations are investing as they are. So it should be a really interesting conversation, jam-packed. If you do want to help me co-moderate and want to throw in questions in the Q&A, I'll be monitoring those. Won't be able to get to everyone's questions, but if there's a few that are on point with what we're talking about, I'll definitely integrate them into the flow of today's conversation. Also, last announcement for now. Right around 45 minutes past the hour, if you're watching live, you're going to get an email from me, another one, I know, apologies, and it's going to be asking for your feedback about today's episode. Would really appreciate if you took the 2 minutes, multiple choice, 2 to 3 minutes, just to give us some feedback on how we did today, and most importantly, what topics we should be covering throughout the calendar year. That's how we get to serve you guys the way we have for the past 11 plus years during this show. All right, let's start with strategy. As I mentioned, I'm going to bring in Karen Hanlon again. She's the Chief Operating Officer at Highmark Health. Karen, how is Highmark approaching consumer centricity, and maybe provide an example how this sort of shift or mindset has influenced your decision making and the executive team's decision making?
Sure. Yeah. Thanks, Eric. So we started our shift in the mindset probably about 5 years ago, and we were embarking on a new, fresh strategy, and really just looked at the problems in healthcare and said, for us, we believe there were two big shifts that were necessary to solve some of those problems because they are decades old problems that as an industry we've really had moderate success in dealing with. The first shift was to change the way the consumers engage in healthcare. And the second was to change the way payers and providers interact with each other as well. But the experience we were seeking was one that was simpler, less fragmentation, less complexity, more proactive in nature, so that we're getting the right information into people's hands at the right times, and more personalized, right? So that they want to engage with it because it's relevant for them at the time that they're seeking service. And so that really led to our shift to think about moving from transactions with customers to longitudinal relationship and to all the things that we had to do in response to that. And it absolutely made a difference in how we thought about the technology that we needed, the prioritization of our work, and the things that we had to get done. That shift from a longitudinal relationship to a from a transactional relationship to a longitudinal relationship meant that we start to think about even clinical decisions differently. The one that probably has created quite a bit of stir and dialogue recently throughout the whole industry, and certainly even for us here at Highmark, is GLP-1s. And given the different studies that are out there and the mixed results in terms of how people are able to stay with GLP-1s, the length of time they're able to take them, the impact, and what's the impact both on near-term health and long-term health, that starts to put pressure on that conversation when you're thinking about having a more longitudinal relationship with somebody, when you're caring for them in a way that you're thinking about what their health is 5, 10, 15 years down the road, as opposed to in the next 12 months of the insurance contract. And so it's made that shift to a consumer mindset and orienting around the consumer has had a lot of implications for us as a company and the work that we do and how we think about our priorities.
So you mentioned that a couple of times, shifting to the consumer mindset, and that GLP-1 example is a really interesting one, and obviously one that's topical for everyone. What are you shifting from? Like, where was the focus before this shift? Just to get
Yeah.
perspective of the journey, because my guess is a lot of plans are either on a similar journey or getting ready to start that same journey.
Yeah, yeah, probably like a lot of health plans historically, right? We're a many decades old company. Um, We were first and foremost a commercial insurance company that sold to employer groups, and for many of us, Medicare business, Medicaid business, ACA business, are newer lines, and increasingly the consumer is the person buying the insurance product, right? And so that shift from a commercial insurance company that was accountable for processing membership, billing properly, and paying claims to a company that is really thinking about how do I engage with somebody in a way that helps them to be more healthy, that helps them to take better care of themselves, right? Over a sustainable period of time, over a longer period of time, was a little bit of a shift. And I don't want to suggest that historically the company wasn't focused on health. It, of course, was. We are a mission oriented company. But how we think about accomplishing that objective now is different than how we thought about it 10 years ago.
Love it. We're going to get back. I want to come back to you later on. We're going to talk a little bit more about some of the repercussions that this shift has made on how you just think about resources. But before we do that, let's move on and take another perspective. Similarly, so on the West Coast, Cambia is focused on delivering a more person-centric care and doing it in a frictionless way. So Laurent, again, Laurent Rotival is the Chief Information Officer and EVP at Cambia Health Solutions. How are you guys approaching this, and how are you pushing through this shift in mindset as well? Maybe provide an example of how you're impacting and improving the consumer experience.
No, thank you, Eric. And listening to Karen, of course, it's we're very like-minded and passionate about the individual. A little over a decade ago, our leadership team decided with a similar view on sort of the transformation we were seeing, outside of healthcare, right? This sort of consumerization, this personalization, the emerging technologies, whether it was the smartphone, with the internet, of course, prior to that, of course, the portability of the smartphone and seeing how that had transformed all of our lives, right, outside of healthcare. It made total sense, and to some degree was very embarrassing to realize how far we had to go in healthcare to kind of match and replicate those initiatives. Cambia has been for over a decade now, core to its purpose is to really serve the individual in the most personalized way possible. And the individual, again, similarly to Highmark, we're an organization that's for Blue Cross Blue Shield health plans in the Pacific Northwest and in Washington, Oregon, Idaho, and Utah. And so our core focus has been serving self-funded employers, fully insured, ACA, Medicare, et cetera. But really, we went and took a step back and say, to serve that individual holistically, you can't think of them exclusively as their annual enrollment identity as a member, or their episodic identity as a patient, or their employment identity as an employee with dependent. We really needed to think about them holistically, and that has inspired us for almost 2 decades now into thinking about what to do, and what that has led us to do as we learn from retail, transportation, financial services, is we decided to become sort of very data and tech forward in our approach. And that led us almost a decade ago to first start with early digital health investment. And we founded with our colleagues at Blue Cross Blue Shield of North Carolina an organization called Echo Health Ventures, would let us to do sort of 5-7 year out early stage seed to Series C investment in companies that we believed were founded and born to achieve that mission in healthcare. Then we proceeded to building a platform from data to AI to integrations, all the way through digital experiences that would allow us to build these experiences and make them real. And that also led us to become founding members of the Karen Alliance and the Da Vinci Work Group at HL7 to advocate for open standards, because we believe that to be person-centric, you also have to believe that the person who is best to make decisions for themselves is actually the person themselves, not their health plan, not their employer, not their doctor. And so the ability to make that portability of data and personal information, as Karen mentioned, on a longitudinal basis, and to make sure that the individual, per HIPAA rules, can actually access it, ingest it, download it, and take it with them wherever they think they're going to get the best care is critical and important, and we invested in that. And then, of course, we went into building digital apps, digital solutions, integrating third parties, and we spent the balance of the last 3 to 4 years, deploying those across all 4 of our states, across all of our lines of business, and all of it on sort of a highly flexible, innovation product life cycle. So we're pretty excited about that, and of course, like everybody else, we're big on AI now, which I think is going to be perhaps that missing link to help us create these deeply personalized, intuitive, natural language solutions.
Okay, yeah, I want to go there a little bit later on. I also want to get into sort of how non-healthcare organizations influence some of your thinking. So I'll come back to you in a little bit. Incidentally, folks, my team wanted to remind you all. So I take notes during the show. Sometimes, hopefully you don't hear me type it, but I always take notes and capture all this stuff. If you want a copy of my unabridged notes, typos and all, but just everything I'm typing up during the show, fill out that survey that comes out at 1:45 East Coast, 12:45, East Coast, and we'll give you a copy of those. One more thing too, I'm heading out to San Antonio to Rise. Many of you are probably as well, March 11th through the 14th. If you want to connect one-on-one, let us know. We'll put up a poll and I'll reach out and have my assistant reach out. We can set up some time to see each other in person. I love doing that at those big industry events, like I did with Karen just a few days ago at Vive. So Karen, coming back to you, you talked about how historically you were focused on group customers, even though you were focused on well-being of the individuals. The strategy of Highmark was groups. So we started talking about this when you were answering initially. Let's talk, how does this evolution from group to consumer, the individual, how does this feel and look within the organization? How does it influence decisions, and what are decisions that you have to make that where maybe you're getting a different answer than you were maybe 5, 6, 8 years ago when you were focused on the group? Maybe provide an example of how things are going there, what a decision-making process looks like today at Highmark versus maybe 8 years ago, 5 years ago.
Yeah, I mean, the investments you have to make are a little different. And Laurent pointed to this. I think, we've had to develop new capabilities. We've had to develop new skills within our teams. It all starts with data, so we had to undergo a significant data effort first, build out that longitudinal record about the individual, develop via the standards that were referred to, the capability to transact data back and forth so that the clinicians had all the information that we had, and similarly that we had all the information that they had to best serve that joint customer. So there was a lot of capability build that we had to go do. And then, on the other side of it, frankly, because you can't, when you think about the cost structure of the company, you can't just add all of that. We had to find places where we were doing things that we could be more efficient about. And frankly, that the consumer and the employer valued a little less. And we had to get more efficient about those things and make changes in kind of the legacy activities of the company. And those things play out, every day as we're prioritizing and making decisions, that we're creating space to really invest in that consumer experience. We've got League here, of course, today. We put an entirely new digital front door in place, and we're using that as, the spot for our customers to come to access everything that they need to access, to make it as simple to access that as it can possibly be, to enable the experience in a way that they don't have to go 10 different places to find something and sign off or sign on to those applications, 4 different ways. And so we've deprioritized some investments to make the room and the space to invest in the things that we needed to prioritize the consumer.
Yeah, those are tough calls, but you have to make a commitment. The organization's committed. And I think, so in the boardroom, you make this big corporate strategy shift to the consumer, and then strategic initiatives to execute on said strategy is the hard part, right? Execution, devil's in the details. So I want to talk now about how health plans are moving from segmentation to personalization. So I want to bring in Mike Serbinis. He is the founder and CEO of League. And Mike, what steps now do executives need to take so that they could effectively operationalize personalization at scale, right? We heard both Laurent and Karen talk about the importance of data and the importance of figuring out how to use that data to go from segmentation to personalization, but that's super hard to do. So can you share an example of how that all works? And
yeah, of course. I think first of all, everybody wants it. There doesn't seem to be much doubt about that. The idea of helping guide plan members down to the N of 1 to help them get the right care at the right time comes with all kinds of benefits and outcomes and economics. To do that, and you've heard this in both Laurent and Karen's overviews, you need a unified experience, one place to go to access the services that matter to people versus 38 different places to go, and it's a treasure hunt, when you actually need something. A unified experience is one. 2, having the underlying data and operational model to touch members, enable you to touch members not once a year or once every other year or only at open enrollment, but daily, weekly, monthly, not only when there's an episode of care. And to enable that, you really need to unify your data to deliver that kind of individualized experience. We've done this with Highmark and many of our, I would say almost all of our clients, leveraging Google Cloud, bringing in the data, normalizing it to FHIR. You heard about Laurent describe their involvement with HL7 and the standards. So standard format, and then really leverage a recommendation capability, AI, machine learning, to drive people to the right action at the right time. Last year, we delivered 100 million of those recommendations to our end active users, of which 65 million of those were actually completed. And if you think of that, I mean, that's an incredible conversion rate. Even if you think of normal standards around email open rates, maybe 1 or 2%, and then conversion from that, maybe a fraction of that. So leveraging the data to get to the right person at the right time with the right recommendation can drive huge conversion. And one example, and I'll just take a slice of what we've done at Highmark, getting people to be able to access mental health services that they otherwise would not have found or been able to access. Spring Health is a partner of Highmark's and partner of ours, leveraging this personalization model. We drove tens of thousands of incremental users, 80% of which had never had a mental health appointment before or mental health treatment before. Drove them for the very first time to get access to care. And that one slice, is worth millions of dollars of avoided costs or medical cost savings for Highmark. And of course, you could imagine the spectrum, doing this across all different types of acute and chronic conditions. There are similarly savings from personalization.
Great. Love it. So I'm going to summarize that if I could get just high level for everyone, and keep me honest, Mike, because I may have gotten this wrong. But 1, you need to create a unified experience. 2, you need to unify the data to deliver that individualized experience. So they are able to do that sort of, I don't know if you called it one-stop shop, but it was I think you used the word 37 different places to go, create consolidate everything. And then the third is to use machine learning or AI or both to leverage that data to create actual insights and recommendations. So those 3 things are sort of high level, the core principles there.
Yeah, and the bow on top is the mindset and the operational change in your team, that this is something you do and that the system and the organization does daily, weekly, monthly, not once a year. So it's changing that time frame of how you engage the end plan member.
So changing the whole culture. It sounds like a cultural change when you say mindset.
Yeah.
All right. This is actually a good place maybe to do my live read. I told folks that League helps support the show. I just want to give you a little bit more information about them because Mike kind of set me up very nicely for it. So we talked about what it could be like for a member if you have a seamless, personalized digital experience for each one of your members based upon their benefits that they have through the product they have, as well as what they need for healthcare. And in other areas of our life, we expect it, and we're going to expect it more and more in healthcare. So how do you do that? And I could tell you, as I know and meet and speak with all kinds of plans and other providers across the land, that doing that stuff is super hard, and trying to do it on your own is super risky. So imagine this: League, over 10 years, over $200 million invested in a platform that provides this consumer experience that allows healthcare organizations to enable their consumers to have an individualized, personalized, one-stop shop experience. This is super hard to do. They've done it. They're doing it for Highmark and other organizations you're going to hear about. It helps improve star ratings, your overall customer satisfaction scores. It drives more self-service, reduces operational costs, it closes gaps in care. I could go on and on. At the end of the day, it's a super, super invaluable for this industry. It needs to happen. And so if you want to learn more about how they're doing it, go to league.com. If you decide you don't want to use League, they have a ton of content on their site, so you can learn more things about what Mike's talking about, so you could potentially figure out how to do it in a different alternative way. I don't recommend it, but they're incredibly knowledgeable with an incredible lot of information. You could check them out at league.com. Laurent, I want to bring you back in, and I do want to talk a little bit, get into sort of your strategy and how you guys built the platform. But before we do that, could we talk about what non-healthcare industries or companies specifically influenced the overall shift from sort of group strategy and traditional health plan strategy to the individual consumer, and how you've morphed your entire technical strategy to mimic sort of non-healthcare industries and what you had to do that.
No, absolutely. Michael also mentioned a comment about time and speed, right? I'd say that's perhaps the most important and most dramatic shift, right? As we interact with a born on the cloud, retail, mobile, ubiquitous company, or a travel company, you get real time answers. They're all very convenient in an app, right, or an app emulator on your smartphone. The updates on your account, whether it's in the case of health insurance, would be accumulators to your HSA, your deductibles, your appointments, your commitment and confirmation of an appointment, the cost of what you're going to be able to expense, the time at which you will receive it is all very clear. And we expect that the information we're seeing is updated as we're taking action, as we're clicking a button to make a scheduling appointment, or as we're clicking a button to commit to something. Our accounts are automatically deducted. We automatically get confirmation of the order. We automatically get a date as to when it's going to happen. And we actually don't even challenge it. We take that for granted. In healthcare, all those things are unbelievably difficult to do, right? And a large part of that is because most of the legacy systems in healthcare, whether they're claims processing or claims administration or benefits administration platforms like Karen and I have, or whether it's electronic medical records, as most of our provider partners have, all of these are very large, monolithic workflow platforms that are not really designed to serve the individual. They're either designed, on the case of providers, to register a patient on an episodic basis and engage them into an ordering process and a codification process, which then leads to billing to health insurance, right? And in the case of a benefits administration platform on the health insurance side, it's about ingesting claims, processing those claims, and then paying those claims, right? And then we have a whole series of ancillary systems that do, case management, utilization management, and things of that sort. But none of them are really about making it easier for the member, the patient, the employee, the individual to access their care. And the other aspect is most of these technologies are 20, 30 years old, right, from an architectural and technology standpoint. So all of them from a data refresh standpoint, right, are doing it with, let's say daily batch files. You look at some of these companies and they'll tell you that they're very proud that they've got full 100% runs the late at night somewhere when nobody's working. And they do batch updates on a daily basis. Well, if you're a consumer of healthcare and you're wanting to have the same experience you have when you buy a book or you book a ticket or you order a car on demand to come to your house to pick you up and drive you somewhere, it is unacceptable to get a message saying, thank you for your order. We'll let you know how your account is updated when you wake up in the morning tomorrow. And we can't confirm anything because we have all these systems, whether it's ours or the ones of our partners, that are working on their own timeline, but certainly not yours. And so one of the big investments we've made, and Michael mentioned it and Karen mentioned it at a cultural level, is that it's not just building an app, right? You can't just build an app. Building an app is relatively easy to do, right? That has all the bells and whistles and the buttons and the promises, right? That the experience will convey. But the question is do you have an infrastructure at the back end that actually can move at the speed of the consumer's expectation? And to do that, you still have batch systems, but you've got to move from daily batch to micro batches, right? Or you got to move to real-time batches. When you do exchanges of files, you can't just do it in one big, massive batch file or FTP. You have to do it on an individual transaction basis in real time, which means that you not only need to have a cloud-native digital platform that resembles and is inspired and architected from non-healthcare, which clearly Michael and the team at League have. We certainly have built on AWS over the last decade. But what you need is a whole ecosystem of systems, many of them legacy systems, that actually have been re-architected, modernized, refactored to provide those real-time feeds, right, that they were never designed to do in the first place. And that suddenly leads to, not only a data infrastructure, an integration infrastructure, a data platform, an ability to actually start masking and abstracting some of these platforms. And what it shifts you to is you can never achieve and replicate the non-healthcare consumer experience if all you're doing is you're building off of your benefits administration platform or your electronic health record platform. You have got to build it on a completely new cloud native platform that reflects and leverages the best practices of real retail consumer companies. And then you've got to make very significant investments that Karen alluded to in all of your legacy systems and your infrastructure and your data infrastructure to make sure that they're providing updates for your cost accumulators, for your appointments, for your payments, for your commitments, for your cost transparency, pricing, predictors, et cetera. I mean, there's so many different things. And these have to be provided on a real-time basis. And that's no walk in the park.
I want to come back to you in a moment. I want an example like of a program that's resulted from this, and maybe we could get a little bit more into like the whole One Cambia platform. I think it's really interesting. One of the things that we try to do, especially around this topic on the show, is just curate who are the organizations pushing the envelope and trying to create what I'll call like almost a non-healthcare experience. No disrespect to everyone here on the call, but there are it is really hard to do, and there's not a lot of organizations doing it. So I want to set the stage because there's an event coming up online on May 7th that League has created called the League Connect Digital Summit on May 7th. And it's from 10 a.m. to 4 o'clock on the East Coast. And it features executives representing organizations who have evolved and are at sort of I would say the top kind of 10%, if you will, as far as evolving to that sort of non-healthcare experience. You're going to have speakers like, Mario Schlossler, the co-founder of Oscar Health, David Bates, the CEO of Linus Health, Christine Turner, she's the COO over at Santa Clara Family Health Plan. The VP and Chief Innovation Officer, Henry Ford, will be speaking. Karen's boss, David Holmberg, the President and CEO of Highmark, will be speaking. Michael Lewis, the author, is going to be talking as well. And so if you want to go to that and not have, it's free of charge to come, but if you want us just to deal with the registration for you, Jessica Tenzer will take care of that. Our producer, she's going to put up a poll. And if you, again, it's May, as the poll just blocks, but if you hear, it is all day on May 7th, 10 a.m., not all day, but 10 a.m. to 4 o'clock East Coast. It's a one-day virtual event. If you want to join, we will register you all for that. So I want to come back to Mike Serbinis. Mike, obviously everyone believes that if the more personal you could get with an individual, the more of a relationship you could build, that's going to lead to better participation and engagement from each and every member that we're all taking care of and covering here. But unlocking that is never easy. So could you provide some more strategies you've seen that are working and keeping members engaged, and maybe provide an example of another organization who's doing it and how they're doing it?
Yeah, totally. I mean, I think the key is to have something to talk about with members outside of particular episode of care. And so we have this concept that every user, every plan member has within the platform the idea of a personalized health journey that is constantly evolving and changing. And it's constantly something the platform is engaged or trying to connect with the end user on. And it's an approach rooted in behavioral science, leverages AI and engagement loops to create that idea of sustained engagement. This is a thing that you are coming to all the time. It's a trusted partner in your health. It's not just a system where you go and check a transaction. And I'll give the example of an organization, and actually I'll pick up on some of Laurent's points. Like, you have these legacy systems that are largely transactional. They're not systems of engagement. They are systems of record. And the example I'll give is the global parent of John Hancock, a company that many of us know. Manulife has over 30 million members worldwide that they offer individual, group, health, and also life insurance and some other products too. They'd gone through an investment cycle to build a new member portal and app, largely transactional, connecting to those largely legacy transactional systems. They chose to embed League in that new app and portal and in particular, embed the personalization and health engagement capabilities of League. Within 3 to 4 months, and it's the fastest we've seen, they saw a 200% increase in adoption, almost 8x now, but 5x in the first 3 to 4 months increase in the overall engagement. Fast forward a year, 80% of that entire population is activated, engaged digitally. And we're talking like in that sort of 30 to 40% are engaged monthly. And of those, most are engaged weekly. And so what does that mean to them? I can give you lots of examples, but number one, a total reduced burden on their call centers. These call centers represent tens of millions of calls each year. So this is a huge savings for them, lowering their overall cost to serve. And then, of course, this personalization capability, connecting people to the right service at the right time, is also supporting care gap closure and journey adherence. One last one that I'll give you that is an exciting one, and it's, I would say, in a developing story, is they've grown an important new asset that they did not have before. And that is a far more rich, real-time, living, breathing picture of their population health. And so you could say, well, what do I do with that? And of course, there's many, health outcome opportunities there. But an unintended opportunity is this idea, a very powerful idea and potential future tool of predicting capital reserves, really building up from the N of one up to the whole population of how much capital should we reserve for different health conditions and future risks. It's a totally different approach to looking up historical actuarial tables, building from this brand new data asset.
It allows better forecasting and prediction, more accurate for all kinds of parts of your business. In this case, with an insurance carrier, it's all about how do you manage those capital reserves, and you're allowing them to get better at it, maybe even reduce it in different areas.
And even highlighting, because you can do this now, building up from raw data, highlighting where it's worth investing and how much it's worth investing in each particular area to release or move reserves to other areas and be more efficient. Pretty powerful.
It's good stuff. And we're getting tight on time. I want to keep on rolling. This last segment, sort of the why behind all of this. I know it sounds potentially obvious, but this is, as in preparation for this show, this is some of the stuff I've been looking forward to the most. So I'm going to bring back in Karen Hanlon. Karen, you've obviously invested an incredible amount of resources into shifting your strategy and culture at Highmark. And so as you're thinking about your paying commercial clients, where, even though you're serving them well by serving the consumer better, you're now shifting your strategy, as you talked about earlier. So can you talk a little bit now about sort of what that looks like, what that means, and how that's sort of impacting Highmark as an organization?
Yeah, first of all, we believe that, as I said earlier, the pursuit of better health is this change in how consumers engage is critical to the pursuit of better health, and that is the most sustainable approach to really transforming healthcare in a way that we create longer term affordability. Without effective consumer engagement, we just really will not be able to get after underlying cost and change the cost trajectory, which we believe is critical. And at the same time, I think I mentioned this earlier, we also believe that we can enable that greater engagement through a tighter relationship between the payer and the provider. And so from a business standpoint for us, the why is to pursue the mission around health and focus on that engagement as a key enabler. in terms of competitive dynamics, it is a differentiated strategy. Those, especially the provider component of the strategy and the changed and deeper relationship between payer and provider. In most of the markets that we serve, we have enough market breadth and depth that we can have really deep work with the providers that is meaningful for both us and them, and that ties to that different consumer experience and different level of engagement with people as they're, traveling their health journey. And so it's just been really important for us as we pursue the mission, but also as we pursue the competitive differentiation in the market.
So for you guys, it was all about how do we get, now you could create a competitive differentiator in your market. I know, you compete against nationals. You're probably not going to be able to outscale them, but you certainly now have an additional potential advantage against them in your markets. And what about for sort of the individual business, sort of the ACA, MA, even K?
Yeah, I mean, same concepts apply, and I think at the beginning I referred to the personalization as kind of a key tenet of our strategy. The understanding of that individual, the tie-in of that understanding to how we think about what will resonate with that individual, what do they need at the moment, how does that tie to the re-enrollment process? I alluded to earlier just the change in the way that people purchase their health care, and the shift that's happening really to government programs in most markets where the individual is deciding, but even within the employer group strategies, right? The employers that are offering healthcare programs are providing, more options for their employees, more discretion of their employees, and we believe that more direct engagement with those individuals and enabling them to more effectively engage in their health will make a difference for us in terms of the annual enrollment cycle.
Makes sense. Laurent, I want to get your perspective on this too, and maybe answer it in the form of a story or an example. So you talked a bit about this platform you built at AWS, and sort of you've made significant, obviously, investments over the last decade in doing so as an organization. So could you provide an example of a result of that to maybe allow all of us to illustrate why that shift was necessary? Maybe that one around the pharmacy that you shared with me.
Yeah, no, sure, for sure. And, there's, I mentioned earlier about the timeliness and the veracity of the information that's in front of the consumer, right? So take on the pharmacy side, one example there is that our members, as they sign on and to their app, can see their whole medication history. And immediately based on that medication history, we have a service that's obviously through integrations at the back end, but invisible to the consumer. They can see the relative effectiveness at all times. We are constantly looking at their medication cabinet and contrasting it to not only what evidence-based effectiveness ratings are saying for those particular drugs, but also giving them guidance on potentially equally effective, lower cost drugs. And if they were to choose to pursue that, for example, they can automatically click and find and go to their direct pharmacy or have a message to their provider to be able to get a validation for the change of those drugs. This is all happening in the app in real time. And if they have questions, of course, they can click, as you would expect as a consumer in a retail environment. You can click and chat with a pharmacist, for example, and have in an asynchronous, either real time or asynchronously, have a conversation with one of our pharmacists to be able to ask questions on what the implications of a change might be, whether it's from a quality of life, contraindications, or potentially cost. And so that is a relatively simple but very powerful and highly used example. One of the other aspects, and I think,
Can I ask you a follow-up? I want to ask a follow-up to that because it's actually not my question, but I've been holding off, and it's from an audience member that submitted it. What were the necessary processes and data changes within your platform that you had to make to allow that personalization for your pharmacy program?
So one, you have to ingest all of the data, right? And so some of it is claims based. It's for the history. The evidence based efficacy data comes from other sources externally, right? To Cambia. The consumer behavior data also comes from internal behaviors, either from our claims platform or other behavioral data sets that we have. From a standpoint of pricing, you actually have to go and pulse the pricing from specific, third-party resources. Looking at the risk profile of the individual, you also need to look at social determinants of health and a series of other qualifiers for the individual that help you understand what their relative risks are based on SDOH or other criteria. And all of this needs to be ingested. All of this needs to be updated on a high frequency basis, different frequencies on the type of the data. And then, of course, you need to have an assurance that your data is complete, is high quality, is relevant, is the person's data. And then you need to transform that data to provide insights to the individual so that that individual then can take action. This is what has required us to build all those layers in the stack that we were talking about earlier. And that's just one use case, right? But you can apply this to many others.
Incidentally, folks, last poll of the day, our episode next week is on innovating product design. So for growth and member engagement, related, but definitely a different angle. We've got Karen's colleague, Maria Baker, VP of Health Strategy and Delivery at Highmark on. We also have Lena Perlman, who runs Medicare products for SCAN. We have the Vice President of Product Management at Mass General Brigham Health Plan. It's going to be a great episode. So if you want us to register you, it's next week, Thursday, 12 p.m. East Coast time, the 27th. So I want to, Mike, I think most health plans, believe they need to solve their data challenges before they can improve the consumer experience. I mentioned how there's very few organizations who have sort of like successfully done this, right? Highmark and Cambia are sort of in the elite here. So why is it important for those listening to think about strategically to do both, like to walk and chew gum at the same time? And how did Highmark do this as they incorporated their digital strategy into their overall consumer-centric strategy that we heard from Karen?
Well, look, I think transforming CX is a customer imperative, and it's only becoming more so. You can't afford to wait, really, to get things quote unquote perfect. As for data, siloed, fragmented data, legacy systems, I mean, this is the norm. We see it in every single health plan, no matter how much they have invested. There's this constant legacy and need to refactor, need to kind of evolve the data strategy. And, Laurent gave this example of moving from an example where you're basically running mostly a batch model with legacy infrastructure, running nightly runs, to a model where you're ingesting data from like all these different sources, real-time processing, creating inference to drive action. It's a very different environment operationally from a cost structure, security, et cetera. Anyways, the idea that you can wait to get one done, get the data done to then enable the customer experience that is perfect, I think is a fallacy. I think you need to parallel path the two. Highmark absolutely did this. We see this with really most of our customers. Get the data work started, get the unified experience, digital front door work started. In the Highmark case, and frankly, most cases, like there's a transition where we're pulling from legacy to start, but then we're going cloud native or in a more unified way over time. I would say, without belaboring the point, you end up generating a lot more data with this unified experience that has a 10x the normal engagement. And the insight that I would share that is, I think, worth gold is the data that you will generate from a high engagement experience will be as important and perhaps even more important than the data you already have. So if you wait, you're just prolonging getting an effective experience and frankly an advantage of how to better serve your customers.
Incidentally, if you want folks to get really devil in the details as far as a blueprint on how to execute this and create whatever business case or PowerPoint you want internally to share with your board, your leadership team, I had the privilege of doing a deep dive one-on-one interview with Mike on the podcast back in mid-January. So if you want to check out that recording, it's already done, and we get into the blueprint. It's not really a commercial episode. Believe me, it's Mike providing all the guidance for you. I encourage you to check that out. Maybe Jess, in the show notes on the podcast, or maybe in the chat, throw the links to, let's say, Apple and Spotify. That should cover most people to that episode. You can take a listen to it. Mike, a quick follow-up from one of our listeners right now. As a member moves from one plan to another, how is the history of that member's health behavior and information accessed and leveraged to deliver a personalized experience? Especially, like, let's say Highmark gets a new member. Like, how does that work? And is there a way to do that?
So I would say today, for the most part, it doesn't work, or it works poorly. But I think the nirvana is this idea of universal data portability. It's something that, with the foundation in place, standards like FHIR, capability and frankly requirements and regulation now that you can take your data with you. It's something that we expect to see more of. We talk about this concept of the League network, where we expect most of our deployments to enable that kind of ingestion, so your data goes with you wherever you go. And honestly, if you want to get to the idea of personalization and driving the optimal sort of end result, you want as much of that data to go with you as possible. So universal data portability, I think that's where we're headed. There's many glimpses of it today, but I would say we're not there yet as an industry.
Good stuff. I want to come back to you for one final question, but before Karen and Laurent, last question from the audience I'm going to take. Our guests first, Karen, has Highmark done a financial analysis of the revenue expected from this investment over time, and how much of the balance sheet will personalization contribute over time? Do you have a sense of that, or could share at least a mindset behind that?
Yeah, I mean, I would say a couple of things. So at a macro level, of course, as we were embarking on this, we had a view and a business case of the benefits that would be derived. And as you would imagine, they took the form of increased enrollment within the health plan, care cost savings associated with, that healthier outcome, those sorts of things. And that's over a longer time horizon and at much more of a macro level. I will say,
Do you have
at a more
I didn't mean to put you on the spot, so if you don't
Yeah.
know this, but like when you say longer time horizon, do you have is that 5
Yeah.
years, 4 years, or
Yeah, we actually used a 7-year time horizon on that.
Okay.
Yeah. But at a more tactical level, and probably in a more meaningful way, and Mike referred to this when he was talking about our solution around mental well-being. For every one of those health solutions that we pull into our portfolio, we have a set of key performance indicators that we expect to see out of those that are exactly as you would expect, right? They are patient or member experience. They are driven around the member health outcomes and items that are particular to whatever the condition is that we're looking at. Of course, there are cost metrics in some of those. And so on each of those solutions that we've pulled into that holistic experience, we have a set of expectations around the outcomes, and we're monitoring those regularly and then modifying and adjusting. The work that we're doing with League around engagement, if we're not seeing the right engagement levels, we're working both with our internal solutions team and with League to figure out why not and what do we have to do. Are we not pinging the individual at the right time in the right way? Do we not have great contact information? Talk about data being an arch nemesis. I would throw into that category contact data and contact preferences as another area where, as a subsection of the data topic, you could probably have your own show on. And so we're measuring at a very refined level and then using that to do the work to make it better.
Ron, I'm going to ask you the same question in a moment, but quick just quick follow up to that too, Karen. So as far as you're in, let's say MA, where a lot of people have a lot of stake in MA, have you seen any impact through sort of your digital strategy around retention or anything like that yet? Or is that still too early to tell and the impacts of the league?
It's definitely still too early on retention. Because we've been building the portfolio. We went live with the new digital front door beginning in 2023, got it fully implemented in 2024. So it's still too early to point to retention changes or improvement. But I will say when we look at the experience broadly, and I'll use Western Pennsylvania as my example, we are absolutely seeing a different net promoter score in Western Pennsylvania, which is where we have kind of the deepest set of capabilities, both from an engagement standpoint, but also as it relates to that payer-provider relationship. We're seeing the highest net promoter score in that market relative to any of the other markets. And we see the differential in that net promoter score when we're doing the deep work with the provider or not, right? So even within Western PA. We're feeling increasingly optimistic about the demonstration of outcomes and proof points. We've got documented savings at this point on our virtual physical health program. And as Mike said, we're identifying who to push that program to. We're pushing it through our My Highmark platform, and people are engaging quite effectively with it. And as they engage with it, we're seeing a high customer satisfaction score, and we're seeing improved clinical outcomes that are driving savings financially for the employers that are buying it and for our fully insured book of business.
And Laurent, similar or anything to add as far as your perspective from Cambia?
No, for sure. I mean, we're winning more business. I mean, we've been in production for a number of years. We're winning more business. We've got probably a 10x increase in engagement over the last few years of our members. We've seen a 170% increase in finding care, where our members are actually identifying the providers, the cares, the specialists that they require, and they find it easily and they take that action on their own. And of course, that's expanding the population of members that are taking advantage of all the programs and the investments we're making on their behalf. And as Karen suggested, it's leading to significant cost productivity and utilization, because they're getting the right care at the right time, earlier, on the basis of their needs. And it's allowing us to serve our members far better than we did without it. I'd also add that from a cost standpoint, and Karen alluded to prioritization and how difficult that can be, we've chosen years ago that this was going to be the way we do business. And so we have shifted. So actually on a year-over-year basis, if you look at our total technology investment and operating cost, we have actually managed to achieve cost productivity so that there is no net increase in cost from this strategy. So it's leading to benefits and utilization. It's leading to a higher win rate in our commercial teams. It's leading to higher engagement, higher confidence, better care, better quality outcomes for our members, and no increase in cost at an operating level. So it's pretty exciting stuff.
Mike, what's the easiest way in the last minute here to take that first step? Like if they were going to go to the league website, like if you were, this is a big shift, right? What's the easiest way of doing this so that it doesn't look too daunting for everyone? And we'll close it out with that question.
You can absolutely come to the League website, reach out to me direct, mike@league.com, or come and see us at one of the many events, Vive, Health Evolution Summit, and we'll be happy to engage right away and help paint a roadmap for you.
Right. If you need Mike's email, again, it's mike@league.com, or you can contact me. I'll make an introduction. Everyone, thank you so much. Really appreciate it. This was great. We could have gone another hour. I've got all kinds of other questions I want to ask, but this was awesome. Thank you all for the time you took to prepare for this. For everyone listening, watching, thank you for tuning in. We do not take the time you spend with us lightly. We hope you use the ideas, the insights, the bright spots shared today to inspire your thinking and enhance your company's approach to improving healthcare for all of us, frankly. So we do produce this show for all of you. Remember, this is your Bright Spots in Healthcare podcast. Thank you very much, everyone. Have a great rest of your day. Take care.